Regarding the Philippine medical education, to date, there are about 38 medical schools in the Philippines, but only 3 out of the 10 are public medical schools. The rest are private institutions. This data supports the following contention and gaps. Firstly, the tuition fee are incredibly high, making it difficult for a resource-limited but deserving student the opportunity to study medicine and go back to serve their community. Secondly, and although the PRC certifies about 6,000 medical doctors annually, many medical and healthcare positions in rural and geographically isolated and disadvantaged areas remain vacant. Work opportunities in the urban setting and abroad appear lucrative, profitable, with even more options for learning. This mismatch in wage and labor prompts immigration to higher income countries. Some doctors see professional and career development and attraction to higher living standards, producing now a shortage of doctors in the Philippines, with a ratio of one doctor for each population of about 28,500, which is far below the WHO recommendation of one doctor for each population of 1,000. This ratio capitalizes on the undersupply of medical doctors in rural areas, delayed delivery of health care due to long travels to other provincial capital or even to the metro to seek consult because they lack specialized care in the community setting. Internal medicine has been one of the common track by doctors, and this was actually based on the Philippine Health System Review that over 17.5% of doctors choose internal medicine as their track. However, moonlighting seems to be the track now that most physicians take due to it because of the direct financial compensation. So at the end of the day, this is the glaring gaps of Philippine medical education in our system. How about the universal health care? How do I implement it? Implementation of the universal health care addresses both the process and the people. The process should identify the gaps in the system, such as we all know the fragmented and overlapping roles and responsibilities of various health agencies, the communication between these agencies and between the patient, and the precise strategy of each sector. An itemized approach providing immediate eligibility to health services, including preventive, curative, rehabilitative, and outpatient drugs, need to be addressed. The delivery of health services using a people-oriented approach centered on people's needs and well-being, mindful of differences in culture, values, beliefs, should be emphasized. An approach which entails opening communication lines between the informal support network considers the interests of our stakeholders. Part of his strategy is to mitigate internal resistance and sustain momentum throughout the implementation. Subsequently, I feel the administration should do programmed reassessment as a feedback strategy. Lastly, the IATF. How do I feel we should respond? Health organizations like the PCP should always work hand in hand with the government agencies like the IATF and the DOH by strengthening our role as credible scientific and technical experts with international partners for COVID-19 science and public health practice. The health organizations like PCP should be allowed to give technical advice, draw the implementing rules and regulation, and proper implementation to prevent, detect, respond, including ensuring timely and accurate data to inform the decision making relevant to the IATF and the DOH. Healthcare professionals must be the leader in developing science-based policy recommendations for the control of COVID-19. I feel that the health organization should bind together and establish a task force to address these specific aspects, formulate a strategy for IATF, including training and capacity building of data scientists to analyze and interpret surveillance data for decision making, a team to promote international coordination and regulatory frameworks, ensure this responsiveness to emerging and now our problem, the re-emerging mutants. This role of health professionals should aim to contribute to scientific understanding of COVID-19 and address crucial unknown regarding clinical severity, transmission, and lately, you know for a fact, there are some studies showing it's airborne, duration of immunity following infections, and even vaccinations through the support of special investigations. The healthcare professional organization shall assist in strengthening national readiness to implement and evaluate vaccination programs and the use of therapeutics when available. The development of protocols to introduce new vaccines, therapeutics, development of communication materials, to engage policymakers, and even to the frontliners, to the communities, which needs to be addressed. Lastly, with some members being on the ground, the healthcare professionals should also provide technical assistance in monitoring and evaluating this data analysis and assessment of the safety of vaccines and therapeutics. In other words, our expertise are a key factor in the policies of IATF and the DOH. Again, these are my views, and I hope I have given you the proper view of how I think we should help in promoting care and satisfaction in addressing the different issues of concern of the COVID-19. Keep safe. Thank you.